94.3 WYBC, the rhythm of the city. I'm Wanda Coppage, here speaking to Dr. Silvestri from Cornell Scott on the issue of COVID-19. In fact, we're going to be doing this every 2 weeks, bi-weekly, just giving you an update of what you can expect, what you need to know, especially as our children go back to school and we're dealing with this pandemic. It's still affecting us. What we need to know about COVID-19 and everything that goes along with it. So it's nice to have, we have the briefings every single day from our governor, but it's nice to have the local one-on-one connection with our Cornell Scott and our very own Dr. Silvestri. You may remember him from the doctors, Go See the Doctor from the Juan Castillo Morning Show. Welcome.
Thank you, Wanda. It's nice to be back.
Nice to have you back. All right. So today we decided that we're going to talk on what most people are very resistant to. I'm not really sure why, but sometimes people are very resistant to the thought of wearing a mask over your face to prevent the spread of COVID-19. So let's start there. What do you have to say about that?
Yeah, I just think that we're fortunate to be in Connecticut where our COVID transmission is so low right now. And I really think there's a few reasons for that, but one of the big reasons is people's willingness to wear masks. And it's just really important because if we let up, we know that things will start getting worse. I mean, we know for a fact now that wearing masks is one of the most important ways that we can prevent the transmission of the coronavirus from person to person. So, the virus spreads in particles that we breathe out, large droplet particles that you can't see. They're called large droplets because they're bigger than some smaller ones. But even when we talk or sing or laugh, these droplets are emitted. And if you're not wearing a mask, they travel through the air to people nearby you who can inhale them and get sick through them. So that's the basic gist of why a mask helps.
Because I remember prior to COVID-19, when I would walk around, I would see certain people wearing a mask, and it's like, okay, well, what's going on with them? What they don't want to touch us, they don't want to be around us. But really, it's the idea of wearing a mask is not so much to protect you from someone, but it's to protect other people from what you may have and not even be aware that you have it. Is that correct?
That's correct. I mean, there are some masks, the so-called N95 masks, which really should be reserved for people who are doing procedures in healthcare settings that are to protect the person wearing them. But a normal mask, even a cloth mask, probably provides some protection to the wearer. But you're right. The main purpose of it is to protect the droplets that you're exhaling when you breathe or talk or laugh from reaching those around you.
So I have a question. The mask, everyone has a mask, because you should have a mask. And then we're going to the part where we're being innovative. We're creating our own mask. They match our bags, our handbags, they match our outfits. Are there any specifics that we should know when it comes to creating or designing our own?
Yeah, it's interesting. The cotton masks that you can make on your own or have a friend make for you seem to work well, and they seem to work up, about as well as just kind of the normal kind of standard surgical mask that you might see in a healthcare facility. So a double layer cotton mask is great. There is some question about whether the neck scarf ones that are really tight around your face, whether those are as good. It's possible that being closer to your face and being stretched is actually not as good. So just kind of a normal loose kind of cotton mask is probably the best kind of a homemade mask.
So if I have a satin bedazzled mask, that's probably not the way to go.
Yeah, well, I think probably a standard cotton mask. You can have you can get a nice pattern on it, and
And what about should there be different sizes for adult versus children?
They do need to be different sizes. I mean, the mask needs to be big enough to cover your nose and your mouth and the surrounding area, without being so big that it's getting in your eye and you're having to mess with it all the time.
Which brings me to my next question. Dr. Silvestri, can you tell us the proper way to wear a mask? I know there's something going on with the wire. It has to be snug on your nose. Can you explain to us how to wear the mask properly?
Sure. Yeah. I mean, the ideal mask, it does have a wire that sort of forms around the bridge of your nose. And covers your nose and your mouth. I mean, that's probably, if I were to have just a single most important point, the mask really does need to cover your nose and your mouth in order to contain the droplets that you're breathing out in order to prevent the transmission of the coronavirus.
So just kind of hanging off your chin around your mouth, that's not really doing anything.
That's not doing anything. That's a mask break.
Because I see it. I'm laughing because I see it all the time. I see people kind of just hanging it like around their mouth. And then when you try to talk, they'll sometimes take it down and then bring it back up. That's defeating the purpose.
That's defeating the purpose. I think if you're going to do that, you might as well take it off so you can, be aware that you're not wearing a mask.
What are the times where you should definitely have a mask on, and then other times where you can just take it off and you can breathe?
Sure. I mean, we know that that indoors and when you're close to other people, really within 6 feet, you really should have a mask on, unless it's your immediate family or those who you're who you're cohorting with. But essentially, anytime you're inside within 6 feet, you need to have a mask on. Even outside within 6 feet too would be ideal. Although obviously, if it's a well-ventilated area and the wind is blowing, there's probably that's a less risky kind of environment. But indoors for sure. Anytime you're with groups of people, that would be an important time to do it.
I know we're going to be speaking with pediatricians in the near future as it relates to the schools reopening and the kids going back to school. But is there any preliminary advice that you can give at this point for parents to get our kids ready for wearing a mask all day if they're choosing to go back for this hybrid model of going back to school?
Yeah, I mean, I think I would suggest starting to practice. It takes a little bit of getting used to. So, I'm a surgeon. I was a little bit used to wearing a mask in the first place. The adjustment wasn't quite as hard, but when you haven't been wearing a mask, it is hard. And I think we need to be realistic about that. And we also need to be realistic about the fact that it's hard to wear a mask continuously for a whole day. So paying attention to what are the important times and when you can give a mask break. So when kids are indoors and around others in close quarters, important time to wear a mask. Give them a break when they're outdoors and running around. It's harder to wear a mask then. And so I think giving them, starting with little periods of time, 5 minutes at a time, building up so that they're ready for those longer periods in school.
What about the heat? We're going through a heat wave right now. We're out walking around with a mask on. Does that relate to wearing a mask at all? Like, should you take breaks? Don't be outside for so long?
Yeah,
I mean, suggest?
I really, I agree. I feel it too. I mean, it's hard when you're outside and you're sweating under the mask. It's real. I think if you can keep your distance from other people when you're going for a walk, if you can stay, 6 feet away from them, especially if there's good ventilation outside, you probably can do without a mask. It's probably a safer area, especially when you're not in a big crowd of people. If you're on a beach with a huge crowd of people all together, you might want to consider having a mask on. It might be a little bit higher risk, but we want to focus the mask wearing on the highest risk situations so that people wear them consistently when the transmission really is risky.
And the non-wearing of the mask, I've been reading, has caused so much conflict in and across the country when you see someone walking without a mask and they're just so adamant on not wearing one. This is a free country. People are fighting employees. People won't let you in the stores. What are your thoughts on that?
Yeah, I mean, I really think that, we're in this together. By not wearing a mask when you're indoor at the grocery store, or the hardware store, wherever you may be, we're putting other people at risk. And, we want, it might not be you that has COVID. It might be the person coming in after you that does. And you want them to be wearing a mask. So let's each do our part, wear a mask so that just becomes the culture and that's what's expected. Yeah.
I would say, because again, I'm speaking with Dr. Silvestri, Cornell Scott. We're going to be speaking in the weeks to come all about COVID from the pediatricians. We're speaking about the mask now. We're going to get into the topic of testing because I don't know why people feel like it is going to be the death of them to get tested because of a swab going in their nostril. But we'll get to that part in life. Before we go there, my last question about the mask, as we mentioned, people are designing their own. You said cotton is the best one. We have what was it, N95?
Yeah, N95s really are not necessary for non-healthcare workers to be using on a regular basis.
So if we're making our own, because I know I'm actually going to start making my own because you save $1 or $2. But when you're making your own, as far as cleanliness, what do we need to know? How often do these things need to go into the washing machine? How many should you have so that they rotate properly and you're not causing more germs?
Yeah, I mean, there's no clear guidelines on this. I mean, I think the important part is obviously if it's gotten visibly soiled, dirt on it, sweat on it, things like that, it might be time to wash it. So at a minimum, you might want to have 2 around so that you could have one in the wash and drying while you have another one that you're wearing. But
I'm going to make 7 for every day of the week.
You can go that way too. I've had patients who have ones that are matching their outfits. I mean,
exactly. You got to coordinate, Dr. Mark, Dr. Silvestri. You have to coordinate.
I can't say I'm that coordinated. I have my nice standard blue mask right here. So.
And you have children. You have little ones. So are you having them wear masks, or what is going on with that? How do you feel about that?
They wear masks when we are around other groups of people, even other kids, especially close together. It's different if you're out on a big soccer field or something. But yeah, when we're together with other kids, they are wearing masks. My 2-year-old, he keeps it on for a little bit of time and then takes it off. But the others, the 5, 7, and 9-year-old, they're pretty good.
Okay. I would imagine the 2-year-old will look at a mask like they look at a nap, like no mask and no nap.
Well, I think even the 2-year-old can teach us something as adults. I think he sees other people doing it, and he thinks that's the cool and that's the right thing to do. And so I think even as adults, probably, the more of us who show that this is how we need to do things together while this is still a pandemic still going on, it'll hopefully encourage others to do the same.
And with that being mentioned, Dr. Silvestri, I know you don't have all the answers. Nobody, even Dr. Fauci, doesn't have all the answers to what's going on with this pandemic. Do you see this being our new normal, that we are going to continue to walk around as a country wearing a mask until we figure it out?
I pray not, Wanda, but
it's so sad.
Yeah, I really hope that once we have a vaccine and we get to the point where enough of us are immune, where it's not being transmitted as readily, that we'll be able to go back to being indoors around each other without masks on and giving hugs like we used to.
I know, right? I miss hugging my people. I'm a hugger. We've been speaking with Dr. Silvestri, Cornell Scott-Hill Health Center. As I mentioned, we're going to be doing this bi-weekly. We'll have new topics because I know you have questions. And if you have questions, please submit them to me. I will pass them on to Dr. Silvestri. We can get them answered. And we're going to be speaking with pediatricians. We'll be speaking about the testing. Today was all about the mask. And thank you, Dr. Silvestri. You gave us some great tips and advice on the mask. We just want you to be well and stay safe. That is the whole point of this. COVID-19 is real, and we want you to be well, stay safe, and consider your neighbor and infecting them. Dr. Silvestri, thank you so much for your time today.
Of course, Wanda, my pleasure.
I'm Wanda Coppage, midday edition of The Workforce on the Rhythm of the City, 94.3 WYBC. Keep it locked in. More of these COVID-19 updates coming from Cornell Scott and Dr. Silvestri in the near future. In the meantime, let's get you back into some music on the Rhythm of the City.